Thank you very much, Mr. Chairman. Before I get into my questions, I want to make a couple of observations. We talked about the three programs that we initiated in the last Farm Bill, the Vaccine Bank, the National Animal Preparedness Response Program, and the Animal Health Laboratory Network. But I want to note that, frankly, these programs are only as effective as the people that enact them. An effective response is dependent upon a highly trained veterinarian and support staff who can work with stakeholders to contain the certain outbreaks. We have a shortage of veterinarians across the country. We need to do and take into consideration, I think, in the Farm Bill, a strong pipeline of veterinarian professionals so that we can continue to enforce the efforts of APHID, which is so important that we have and maintain a trained staff to address outbreaks. And so the Farm Bill, of course, does a host of things to ensure, as I said earlier, maintaining food security and that food security is a national issue. We just need to remember, I believe, that the past year the cost of an outbreak will far exceed the cost of supporting disease prevention programs. Remember that. The cost of an outbreak far exceeds the cost of these prevention programs. With that said, Secretary Moffat, looking at the current response, and you partially answered that question by the answer to the chairman's question in terms of what improvements you think need to be made to optimize future outbreaks. And is there the authority with AVID currently that lacks would provide a more effective response? And because of your previous experience that I'm aware of, not just as a farmer producer, but in California's agricultural department, how think you we can more closely coordinate the efforts between state and federal efforts to manage these diseases?
Well, thank you for that question. And, I think there's a few things. So first, coming, as you recognize, coming from the California Department of Food and Agriculture, in fact, in, I think, early 2020, before the pandemic, thanks to funding from NADPREP and through the partnership that the state and federal government really strongly have in collaboration, we did a tabletop exercise for should there be a foot and mouth disease outbreak in the dairy industry in California. So that funding, I know firsthand how important it can be for states in readiness and preparedness, as well as, of course, with industry partners and university and land grant partners as well.
That partnership's critical.
Yes, it is.
And we need to build on it. Our trading partners often use, non-tariff barriers to, I think, deal with their internal politics in terms of our ability to trade. And I'm wondering if you've developed a strategy toward maintaining our trade efforts when we have efforts to vaccinate, especially in light of the high path impacts and the potential and concerns about them. And of course, we've dealt with depopulation, as you well know.
Yeah, so as your question relates, as we're looking at all different tools in the tool chest, they're very important. And you asked about the different mechanisms that we have, and Dr. Noggle can talk a little bit about some of the lessons that we're learning in the current outbreak and how we're applying that. But I'll just quickly answer the vaccine question. It is very important as we consider vaccine. First off, we're many months, in fact, 18 to 24 months down the road. ARS is now really doing research trials at this point. But important is that as we look at and evaluate a potential for a vaccine, we're looking at things like human health, animal health, trade impacts, and also implementation of a vaccine strategy. So there's many things that we would be factoring and weighing.
Yeah, my time is expiring here. Dr. Quickly, how do our trading partners look at our ability to maintain high standards to contain any health impacts? Could you comment quickly?
Yeah, I mean, our trade partners, we are working actively with many different trade partners around the world on regionalization approach so that we have in place, and this is something we developed since the 2015 outbreak, strong regionalization approach for both high-path AI as well as we're developing it for African swine fever.
And our efforts to improve diagnostic and surveillance technology, it comes hand in hand with that, right?
Absolutely, absolutely. If
How
we know where the disease
how are we
is,
doing
we
there?
can keep it. Sir?
Well, my time's expired. I was asking how are we doing there to improve diagnostic and surveillance technology?
How will we improve it? We will constantly improve it. We're working with our labs network around the country. Rapid detection and diagnostic technology is really important, and some of the funding for the lab network has also been for rapid diagnostic testing as well.